Blunt force trauma: the dangers of driving under the influence. What is driving under the influence? Driving under the influence is when someone attempts to drive while under the influence of drugs or alcohol that impact one's ability to remain focused and drive safely. What causes someone to be under the influence? The most obvious cases would be narcotics, such as weed, alcohol, and other drugs, such as meth. However, some prescription drugs may result in side effects that could make the user unfit for driving, making it important to remember to always ask your doctor about any side effects caused by any new medications. What are the symptoms of being under the influence? Most symptoms are shared between the different drugs. These side effects include slowed down reaction speed, reduced hand-eye coordination skills, making a driver more emotional and prone to rash decisions, and reducing a driver's ability to focus. What are the consequences of driving under the influence? If you're caught driving under the influence, you could face several punishments, such as getting your license revoked, receiving a fine of up to $2,000, and even jail time if it's not your first offense. Your driver safety score would also plummet, resulting in you losing out on higher score perks, like discounts on your insurance. The biggest risk of driving under the influence would be the risk of getting into a collision while driving, with the risk of crashing more than doubling while impaired, with over half of fatal crashes involving teens having alcohol involved in some way. How can we prevent driving under the influence? The easiest way we can prevent incidents caused by driving under the influence would just be to always have a plan to get home without having to drive by yourself. Be it a designated driver in a group of friends, or just buying a cab or calling a family member to drive you home. The end.